Hello everyone, how are you? We learned today about necrosis, and it's a very interesting and very important topic of pathology. So let's start. So first of all, we have to know what is necrosis, isn't it? We know when any kind of damage occurs to a cell, and if the damage continues, the injury becomes irreversible. And that time, the cell cannot recover, and ultimately, the result is the death. So, necrosis has been considered as an accidental and unregulated form of cell death. And the morphologic appearance of necrosis is the result of denaturation of intracellular proteins and enzymatic digestion of the lethally injured cell. Actually, the necrotic cells are unable to maintain their membrane integrity, and their contents often leak out, and they induce a process that may elicit inflammation in the surrounding tissue. So, it's all about the basic idea of necrosis. Now, what is this? This is a normal kidney tubule within viable epithelial cells. Okay, so look closely. This is a normal kidney tubule. If any kinds of necrosis occurs here, then just see the appearance. This is a necrosis and it's an irreversible injury of epithelial cells, and we can see there's loss of nuclei, fragmentation occurs, and leakage of the contents. Okay, so these are the features of necrosis: loss of nuclei, fragmentation, and leakage of the contents. So let's know more about this necrosis. Actually, there are two kinds of changes occur in a necrotic cell. These are cytologic changes and another is nuclear changes. So first of all, cytological changes. The necrotic cells show increased eosinophilia in hematoxylin and eosin stains, and this is due to loss of cytoplasmic RNA and denatured cytoplasmic proteins. We know RNA binds to the blue dye, which is hematoxylin, and proteins bind to the red dye, which is eosin. Okay. And another feature is more glassy homogeneous appearance than the other normal cells. This is the result of loss of glycogen particles. Okay. Now another feature is vacuolated and moth-eaten appearance. Why? Actually, when the enzymes have digested the cytoplasmic organelles, the cytoplasm becomes vacuolated and it appears as moth-eaten. Okay. And another important feature is myelin figures. What is myelin figure? Actually, dead cells are replaced by large whorled phospholipid masses, and these phospholipid masses are called myelin figures. Okay, and they are derived from damaged cell membranes actually. Okay, now what happens next? These phospholipid precipitates are then either phagocytosed or further degraded into fatty acids. Okay, and calcification of such fatty acids results in the generation of calcium soaps. Okay, and thus the dead cells may ultimately become calcified, and this is called calcification. Okay, so these are the cytological changes that occurs in a necrosis. Now, what are the nuclear changes? There are very important three nuclear changes: karyolysis, pycnosis, and karyohexis. So what is karyolysis? Actually, the basophilia of the chromatin may fade, and it's a change that reflects loss of DNA because of the enzymatic degradation, specifically by endonucleases. So this is called karyolysis. Okay, and again, what happens? The second pattern is seen as pycnosis. Pycnosis is characterized by nuclear shrinkage and increased basophilia. Okay, and the chromatin condenses into a solid shrunken basophilic mass, and this is called pycnosis. And it is also seen in apoptotic cell death actually. Okay, now the third pattern is known as karyohexis. What is karyohexis? The pignotic nucleus undergoes fragmentation, and with the passage of time, maybe 1 day or 2 days, the nucleus in the necrotic cell totally disappears, and this fragmentation is called karyohexis. So these three, karyolysis, pignosis, and karyohexis, very important three features of nuclear changes. Okay, now the morphological types of necrotic cells or necrosis. Actually, if your teacher asks you about how you can classify the necrosis, then you have to answer their basic two types of necrosis: coagulative necrosis and liquefactive necrosis. But there are other four types of necrosis, and if we all together combines the morphological changes, then we'll have to say there are actually total 6 types of necrosis. Okay, total 6 types, but the basic two types are coagulative necrosis and liquefactive necrosis. Okay, don't confuse. So let's start these all 6 types. First of all, what is this? This is actually a wedge-shaped kidney, okay? But there is infarction here. So this yellow colored area is infarction, okay? So this is actually a figure of coagulative necrosis. So what is coagulative necrosis? It's a necrosis in which the architecture of dead tissue is preserved for a span at least some days, and the affected tissues exhibit a firm texture, and the injury denatures structural proteins as well as the enzymes, and the proteolysis of the dead cells are blocked. Okay, as a result, what happens? Eosinophilic and nucleate cells may persist for days or weeks. Okay, and actually ultimately the necrotic cells are removed by the phagocytosis. Okay, and ischemia caused by obstruction. Um, Sorry, I have pressed before. Okay, I'm saying the ischemia caused by obstruction in a vessel may lead to coagulative necrosis of the supply tissue in all organs except the brain. Okay, we have to remember it will happen in all organs except the brain. Okay, and the localized area of coagulative necrosis is called an infert. Okay, so this is actually an infert, and the process is called infarction. Okay, now here is some example of coagulative necrosis. Ischemic necrosis of heart, kidney, liver, adrenal gland, other solid organs, gamma of tertiary syphilis, etc. So these are few examples you have to remember. So now, what is this figure? This is actually an infarcted brain showing the solution of the tissue. Actually, it is a liquefactive necrosis. Actually, for unknown reasons, the hypoxic death of cells within the central nervous system often manifests as liquefactive necrosis. We don't know the reason actually. Okay, so what is liquefactive necrosis? In contrast to the coagulative necrosis, it is characterized by digestion of dead cells, okay, resulting in transformation of the tissue into a liquid viscous mass. Okay, a liquid viscous mass, and the necrotic material is frequently creamy yellow because why? The presence of dead leukocytes, and it is called pus. Okay, we have to remember it is called pus. And some example: focal, bacterial, or fungal infections, for example, abscess, boil, ischemic necrosis of brain tissue. Okay, these are liquefactive necrosis. And focal, bacterial, or occasionally fungal infections occurs because the microbes stimulate the accumulation of leukocytes and the liberation of enzymes from these cells. That's why focal, bacterial, or fungal infections or liquefactive necrosis occurs. Okay. Now, this is a very common picture in our clinical practice, and this is called what? This is called gangrene. And here comes the gangrenous necrosis. Okay, actually, it is usually applied to a limb, and generally the lower leg, and which lost its blood supply and undergone necrosis, and typically coagulative necrosis. Okay, and it also involves multiple tissue plants. And when the bacterial infection is superimposed, there is more liquefactive necrosis. Why? Because of the actions of the degradative enzymes in the bacteria. and it attracts leukocytes, and these overall giving rise to the so-called wet gangrene. Okay, this gives rise to the so-called wet gangrene. Okay, so this is gangrenous necrosis. Okay, now what is this figure? This is actually a tuberculosis in the lung, and we can see here a large area of caseous necrosis. So caseous necrosis, actually this term is quite difficult, isn't it? Okay, forget this term. Just look about, look, there is yellow, white, and fuzzy debris. So okay, look closely. There is yellow, white, and cheesy debris, and this area is called caseous necrosis. Okay, so what is caseous necrosis? Actually, the term caseous or caseous means cheese-like. Okay, cheese-like is derived from friable, this white appearance of the area of necrosis. Okay, and on microscopic examination, this necrotic area appears as a structureless collection of fragmented or lysed cells and amorphous granular debris, which is enclosed within a distinctive inflammatory border. Okay, and this appearance is a characteristic of a focus of inflammation, and which is called granuloma. It's a very important term, granuloma. Okay, so you have to remember this too: caseous necrosis and granuloma. Okay, this term, caseous and granuloma, very important term. Okay, now some example: granuloma of tuberculosis, cat scratch disease. So tuberculosis picture we have already seen. Okay, so there was caseous necrosis. Okay, now what is this? This is a, we can see white chalky deposition, right? And this represent actually foci of fat necrosis. Okay, this is fat necrosis, and there is with some calcium soap formation or saponification at the site of lipid breakdown, and this is actually happened in the mesentery. Okay, this is in a fat necrosis happens in the mesentery. So what is fat necrosis? Actually, fat necrosis is a term that refers to the focal areas of fat distraction, typically resulting from the release of pancreatic lipases. Okay, resulting from the pancreatic lipases, where into the substance of the pancreas and the peritoneal cavity. Okay, actually, this occurs in a very dangerous medical emergency, which is called acute pancreatitis. And in this disorder, pancreatic enzymes leak out of the acinar cells and liquefy the membranes of fat cells in the peritoneum. Okay, then the triglyceride esters are split, which are in the fat cells, and these fatty acids combine with calcium to produce grossly visible these chalky white areas. Okay, this is called fat saponification. Okay, and on histologic examination, the necrosis takes the form of foci of shadowy outlines of necrotic fat cells with basophilic calcium deposits surrounded by an inflammatory reaction. Okay, so these are the histologic examination. Okay, now some example enzymatic fat necrosis and traumatic fat necrosis. Okay, so enzymatic fat necrosis, we have already discussed acute pancreatitis, and traumatic necrosis, it's actually occurs in breast. Okay, now here's the last type of necrosis. So what is this? Actually, we of course we know this is a layer of smooth muscle layer. Okay, and the actually this is the figure of artery, and the wall of the artery shows the circumferential bright pink area of necrosis, isn't it? And there is also inflammation. Why? Because the neutrophils with dark nuclei, we can see this is inflammation, and also bright pink area. So this is actually fibrinoid necrosis in an artery. Okay, fibrinoid necrosis in an artery. So what is fibrinoid necrosis? which is later form of necrosis. Okay, and usually seen it is immune reactions involving the blood vessels. Okay, and this pattern of necrosis typically occurs when complexes of antigens and antibodies are deposits in the wall of the artery, and these depositions of immune complexes it comes together with fibrin and they leaked out of the vessels and ultimately result in a bright pink and amorphous appearance, okay, in hematoxylin and eosin stains, and this is called actually fibrinoid or fibrin like. Okay, so this is all about fibrinoid necrosis. And here are some examples of fibrinoid necrosis: rheumatic fever, vasculitis, malignant hypertension, rheumatoid arthritis, SLE or systemic lupus erythematosus, etc. So I hope my discussion helps you at least some understanding about this critical topic. Though it is actually difficult, but it's very important for your exams and your practical knowledge. So this is all about our necrosis. So thank you all for watching my videos. Bye bye.